So I guess first of all, I would like to extend my greetings to my friends and colleagues in Anchorage, and I apologize for not being there in person and being on video instead, but glad to see all of you again. Hi, my name is Scott Kronlund. I'm a family physician from P.1, Washington, now serving as the Chief Medical Officer for Northwest Physician Network, a 400-physician IPA in Tacoma. Well, in the South Puget Sound region, I would say that most of the physicians that I've encountered are really become very separated and distinct from each other, and actually to the point of becoming rather disillusioned. So primary care physicians, for example, don't go to the hospitals anymore and make rounds. The doctor's lounge was where all of the interactions occurred. You know, and primary care doctors aren't there. We have hospitalist programs. A lot of the specialists have kind of retreated to their own procedure centers and the like, and really what I found was a somewhat disillusioned, group of physicians who'd really lost contact. Most of the vendors that I've encountered are people that really do think they understand the healthcare system and they understand how physicians work, and so they go climb into a closet somewhere and create the perfect solution to the problem that they think you have, and then come out and say, here it is, all you need to do is buy this system, and whatever the problem is will be solved. Most vendor relationships are suspect. Is that too strong a word to use? Oh, Pete is just a huge breath of fresh air, by contrast. It's interesting because as we've gone out and I've spent a lot of time with Pete and his staff going out and talking to a lot of physicians about this, and immediately, the first thing you encounter is that bias against the vendor approach. And the fact of the matter is Pete is a really good listener. He's tried to fully understand the problem and is really committed to developing his service in concert with medical practices and the real issues that they're facing. The relationship between NPN and Clarity, I would say, is pure partnership. Working with Clarity in the whole area of care coordination, we've been able to rediscover that a referral is really a clinical activity. I have a patient as a primary care physician that I need help with. I need your help, in caring for this patient. It's really that kind of a clinical thing, and you're going to commit something back to me in return. The challenge is in today's world, that whole referral piece has been usurped in many ways by the payers to mean, an authorization. They're thinking about an authorization from an insurance company. They're not thinking at all about a clinical exchange on behalf of a patient who has an issue. By working with Clarity and taking that insurance piece off the table, I think the provider community has really been able to rediscover the notion that a referral is really primarily a clinical exchange. When you use Clarity, it's real simple because Clarity is doing all of that insurance processing for you. You can generate a referral in 45 to 90 seconds and walk away.